A few years ago, the National Health Service, the government-run healthcare system in the UK, was officially limited in its permissible waiting times for medical procedures to 18 weeks.
This video will be focused on the NHS and a portion of the Bogosity podcast in which it is referenced. Mr. Killian has specified in his podcast that
a few years ago, the National Health Service, the government-run healthcare system in the UK, was officially limited in its permissible waiting times for medical procedures to 18 weeks.
But he has been deliberately vague. Some procedures are carried out much more quickly, as they are medically more urgent. It also varies by region, so this picture isn't as simplistic as Mr. Killian would have you believe. His sources, by the way, include a Pulse article which can no longer be found, and an article from the Guardian newspaper. Sorry, but the Guardian newspaper is not a reliable source of information, as newspapers have a tendency to cherry-pick data. He even goes on to read vast sections of this article himself. Frankly, this is just lazy and pathetic. You have to do better than that, Mr. Killian. It doesn't take much more to delve a little deeper into this claim though. I'll cover it in more detail as we go through this latest piece of Killian-style misinformation.
If you talk to the nutty proponents of universal healthcare, they take an even unbelievable 18-week wait as a sign of government healthcare working, and insist that no one is waiting any longer.
Surprisingly, Mr. Killian has already sunk to a childish and pathetic insults against those who do not want to take the selfish and insane route of completely unregulated healthcare that he is a clear proponent of. This is direct from the NHS website under their waiting time section. You have the right to start your consultant-led treatment within a maximum of 18 weeks from referral, unless you choose to wait longer or it is clinically appropriate that you wait longer. Now, before Mr. Killian gets his panties in a bunch and starts claiming that it means that you can be held back longer than 18 weeks for treatment if it is deemed you are not in clinical need, he is a continual critic of other people reading documents, quote, incorrectly, unquote, or non-literally. So let's make sure he doesn't play that game here. We are well aware that the NHS has some issues, and has had over the course of the last 60 years. But it is not a broken system, and it's certainly not the kind of medieval barbaric system that Mr. Killian would have you believe it is. The article goes further. This includes treatments where a consultant retains overall clinical responsibility for the service or team or for your treatment. This means the consultant will not necessarily be present for each appointment, but will take overall responsibility for your care. The setting of your consultant-led treatment, for example, with a hospital-based or in a community-based clinic, will not affect your right to treatment within 18 weeks. That is a maximum, not an average. Many hospitals have waiting lists that are much reduced from this. Further, if they can't do it, then they are obliged to refer you for private healthcare treatment in privately funded hospitals in order to meet their deadline. However, the article goes further. Patients with urgent conditions such as cancer and heart disease will be able to be seen and receive treatment more quickly. For example, you have the right to be seen by a specialist within a maximum of 2 weeks from GP referral for urgent referrals where cancer is suspected. Mr. Killian neglected to tell his listeners this crucial fact. I have to wonder why this is.
Well, statistics have just shown them to be wrong, and these statistics don't come from some wonky libertarian think tank, they come from the NHS itself.
It's a shame then, Mr. Killian, that you didn't provide the actual source for your statistics, isn't it? I, on the other hand, did look up the mean statistics for hospitals in the UK, and I will provide these statistics here. Additionally, the OMO's Evil has done a very lengthy 5-part series detailing his knowledge of the Canadian healthcare system, which operates as a government-run scheme as well. For now, let's move on.
Currently, over 10% of NHS patients wait longer than 18 weeks for medical procedures, the highest it's been since mid-2008.
Now, those of you who are paying attention to the figures I provided before this portion of the bogus podcast we just heard will recognise this as a lie. The very best he could do was take a limited number of hospitals with lower than 90% of treatments within time and then claim that this is across the board. This is dishonest, but not completely unexpected from a free-for-all anarchist who thinks that the government was responsible for racism.
A spokesstooge for the Department of Health said, "Waiting times go up and they go down, but this data shows that waiting times remain broadly stable."
Stooge, Mr. Killian? You mean like a spokesstooge for free-for-all healthcare like yourself, making claims that you can have a well-run healthcare system that has no government intervention, and that if there is any malpractice within the healthcare industry, well, that's okay, because patients can just file lawsuits. Don't even get me started on the subject of how costly lawsuits are and why this line of reasoning is so ridiculous.
But what this bureaucratic goon doesn't tell you is that even an 18-week wait can mean the difference between life and death. The universal healthcare nuts will tell you that the only people put on the waiting list are people who aren't really sick, whose surgery is elective. But these elective procedures include things like hip replacements and even cancer treatments.
Sorry, Mr. Killian, but quoting someone from the Guardian newspaper who has written this doesn't tally with what is said in both the statistics from hospitals themselves or the NHS Constitution, where it clearly states that all patients with suspected cancer have the right to be seen within 2 weeks of a referral to begin treatment. You are dishonest, as can easily be established just by presenting evidence.
The Federation of Surgical Specialty Associations, which represents about 15,000 surgeons in the UK, say that there's no evidence that the procedures people are put on the waiting lists for are of limited value. In a statement last month, they said, quote, "The lists include types of hip, spinal, ear, nose, and throat, dental, obesity, and cancer surgery for which there is overwhelming evidence of benefit. The only justification for these lists can be that they are a means of reducing expenditure at a time when the NHS faces a financial crisis."
This is another direct quotation from the same news article, and Mr. Killian has repeatedly demanded science-level peer-reviewed sources for anyone debunking his claims, yet is not prepared to invest the same level of research himself. Very poor, Mr. Killian. Just because you can defeat creationists easily in argument where it's easy to find high school level information debunking their nonsense does not make you smart. And this is the evidence right here. What we have is essentially an example of confirmation bias. He's gone out of his way to find an article that badmouths the NHS, whether some of the statistics are valid or not, and used it as a means of arguing for his particular brand of healthcare evangelism. I'll come back to this in a moment.
Peter Kay, chairman of the British Orthopedic Association, said, quote, "This growing rationing is unfair because it is leaving more and more patients in pain, discomfort, and misery. But it's also a false economy because it stops some people from getting back to work and costs the state unnecessarily in welfare benefits for others. Plus, conditions like arthritic knees, hernias, and varicose veins don't get better by waiting, they get worse and can cost more to treat when the patient is eventually treated."
This is another direct quotation from the same article. The article itself is heavily biased in the negative towards the NHS for a very good reason. That reason is because the NHS is in need of improvement. There is no disputing this. However,
it's even worse than that. Since cancer treatments are also delayed, those delays can make the difference between the cancer being treatable and untreatable.
Mr. Killian has again touted his bullshit claim that cancer treatments are considered an elective. It doesn't matter what someone says in a newspaper article. It matters what the NHS Constitution itself says, and if it says that patients have the right to commence treatment within 2 weeks of a referral from a general practitioner in any case of suspected cancer, then patients have the right to be seen within 2 weeks. Mr. Killian's dishonesty has grown to epic proportions now.
Everyone knows that the healthcare system in the US is far from perfect, but clearly government healthcare is no solution. People need to realize there's a difference between free market healthcare and the corporatist healthcare system we have today.
And so here we go. After Mr. Killian has finished ranting about how bad the NHS is, he starts toting his nonsense about free-for-all healthcare. Let's listen on, and I will respond to the assertions made afterwards.
Before government meddling in the 1960s, we had the cheapest, most accessible healthcare system in the world. Almost everyone was covered, and those who weren't could get treatment from the numerous free clinics and charity hospitals that were everywhere. Those were driven out of business by rising costs caused by licensing restrictions, health insurance corporatism, the HMO Act, and many other such government reforms.
Mr. Killian has now gone on to his anti-government nonsense. Before the 1960s, the healthcare system was in worse shape than it is today. The primary reason why healthcare was so much cheaper in the past was because medicine was a much lower technological standard and because medical treatment took place in homes as opposed to hospitals. Mr. Killian's rebuttal to this argument that allowing a proliferation of cutting-edge technologies without regulation would lead to a fall in technological prices does not work for two very good reasons. The first is that demand is limited by the actual requirement for units in hospitals. After all, they're not going to buy one MRI or CT unit per 10 patients if they don't actually need to. The second is in the build quality of the machines themselves. It is, after all, no secret that the better quality a piece of technology is, the more expensive it is to produce, no matter how well established it is in the marketplace, and hospital equipment cannot be cheaply made because of its importance in saving lives. Furthermore, At the early part of the 20th century, very few insurance companies offered health insurance, both because of a lack of demand and because insurance companies themselves were unwilling to provide it. Mr. Killian doesn't seem to know his medical history or that of other countries. Let's move on.
The whole situation makes it clear. If you have a problem created by government meddling, you can't solve it with more government meddling. You get the government out of it and let the one system that has already proven itself come back into play.
It's funny how Mr. Killian claims that free-for-all healthcare has proven itself, isn't it? Let's start with a few comments on the NHS which he has seen fit to baselessly attack on the claim that patients have to wait 18 weeks or more. First of all, it is readily acknowledged that the NHS has its problems, as does every system of medical care on the planet. What Mr. Killian neglects to mention, though, is that in the UK, and in Canada too, the emphasis by patients is to complain about the system and see it negatively when they do not get treatment properly. Negative voices are often heard than those whose treatments go well, because most people never bother to mention that their treatment was perfectly fine. Conversely, in the US, those who support privatised healthcare pretend it is much better than it actually is, whereas in the UK there is no such incentive to do so. Shona Holmes, a Waterdown, Ontario woman who had Rathke's cleft cyst removed at the Mayo Clinic in Arizona, sued the Ontario government for failing to reimburse her $95,000 in medical expenses. Holmes had characterized her condition as an emergency, said she was losing her sight, and portrayed her condition as a life-threatening brain cancer. In July 2009, Holmes agreed to appear in television ads broadcast in the United States, warning Americans of the dangers of adopting a Canadian-style healthcare system. The ads she appeared in triggered debates on both sides of the border. After her ads appeared, critics pointed out discrepancies in her story, including that Rathke's cleft cyst, the condition she was treated for, was not a form of cancer and was not life-threatening. You see, this is the kind of dishonesty that we have to put up with from these people. Aside from what I've already addressed in my response, there is the issue of non-hospital, inpatient or outpatient care. Mr. Killian has neglected to include figures on the state of healthcare for those simply wishing to be seen by a doctor in the first place. California's average wait time to be seen by a family doctor is 59 days. Boston's is 63 days. Now, the average across the whole of the US is 20 days. People on Medicare or Medicaid are forced to wait months in some cases simply because the majority of doctors do not want to provide services to Medicare or Medicaid patients, as they can make more money off of privately insured patients. In the UK, the situation is very different. Whenever you book an appointment with your GP anywhere in the country, you are seen within 2 working days. I myself have never had to wait longer than a week for an appointment, and most of my medical appointments can be booked to occur the same day. Additionally, every patient is entitled to healthcare, whether it be preventive or curative. The emphasis is being moved gradually to preventive medicine in this country, as keeping healthy is a lot less costly than trying to cure an illness that is a result of poor lifestyle or an unchecked medical condition. Patients do not need to worry about paying doctor's fees in this country, and so can readily see the doctor if the need arises, as opposed to trying to weigh up whether their illness is sufficient to justify a costly trip to their doctor. 1 ounce of prevention is worth more than a pound of cure. What do they have in the USA? Yep. For-profit health insurance, and it's conditional too. In the UK, your citizenship or permanent residency entitles you to the same medical care as everyone else. There's also no such thing as pre-existing medical conditions. In other words, you will be treated regardless of whether you are already suffering from a medical condition. Not so in the US, where insurers can declare pre-existing medical conditions to be uninsurable or even render an insurance policy null and void. Some insurance policies also cover only certain types of treatment, and many do not cover regular health checkups. It is common for health insurance policies in the US to provide a copay situation, which functions as a deductible would for other types of insurance, and in some cases this is outside of the affordable range of many people. And there's also the issue of the 50 million Americans who have no health insurance whatsoever. Their options are limited to so-called free clinics, where doctors and nurses volunteer their time to treat people who are not insured. And let's talk about this proposed difference between the corporate model of healthcare and the free-for-all solution that Mr. Killian proposes. Currently, the US operates a private insurance model that is regulated by the federal government. Insurers as well as medical facilities that provide treatment for patients have to adhere to a set of regulations that govern whether or not they are qualified to perform medical treatment. What Mr. Killian proposes is this system of regulation that ensures we don't end up with a bunch of crooks like himself performing surgical operations on people, thereby endangering their lives needlessly, is responsible for the problems that the US has with medical care today. His solution? Take out all the regulation. Take out everything that stops incompetent buffoons like Mr. Killian here from pretending they are doctors and putting people's lives at risk. He proposes that they take out everything that stops unscrupulous crooks from trying to make a quick buck off of the general public who otherwise have no one to speak for them. If Mr. Killian was such a believer in his constitution, he would realise that the federal government is there to serve the people, and regulations put into place are there to stop crooks from getting into the business of playing with people's lives. And this is people's lives we're talking about here, not whether they are going out to buy a loaf of fucking bread at the store. I've included a few videos in the info bar that I've mentioned previously on the subject of Canadian healthcare, which bears partial relevance, and because the author has put considerable effort into them in order to address the misinformation paraded by Mr. Killian and his cohorts on the subject of not-for-profit, government-run healthcare. And what's his response to these facts?
Well, we can trust the free market and keep everyone in line, so you can just go elsewhere if you don't perform up to scratch.
No, Mr. Killian, that is not good enough. One instance of malpractice that results in even a minor health issue, not even talking about a major illness or loss of life, is one instance too many. Mr. Killian's solution might be to file some kind of a lawsuit. No, Mr. Killian. First of all, medical malpractice is a criminal offence. The problem with criminal trials is that the burden of proof is on the prosecution. It's far too easy for the defence to encourage a verdict of not guilty on a technicality, and this is made much, much easier by the removal of regulations that would otherwise ensure proper procedures are followed by qualified and competent medical personnel. Secondly, civil cases require lawyers. The only exception is small claims court. And if you're talking about a serious clinical negligence, many people would not have the resources to fight a protracted legal battle against a wealthy company that can sustain legal costs until the individual is forced to give up. And to address the claim that free-for-all healthcare would eliminate corporate interests? No. Anti-competition laws prevent monopolizing. Removing that legislation won't magically make all companies and corporations behave. Instead, it will remove any legal barriers to swallowing up any company not big enough to tackle a takeover bid of some kind. The only barrier that would exist then is money, and the more you have, the more powerful you become. It's not brain surgery to realise that all it takes is for one or two companies that are powerful enough to begin swallowing up the smaller fish, and you end up with a big conglomerate all over again, and this time they get unfettered access to the whole market without the restrictions placed on them by legislation. Far from preventing monopolies, removing government powers would allow them to exist without any form of checks or balances. To bring the issue of underinsured or uninsured medical care closer to home, there is at least one YouTube user who does not have health coverage of an adequate level to treat what has now become a serious, if not terminal medical condition that because he does not have said insurance coverage he can get no treatment for. His channel is in the info bar. Every year, far too many people in the USA die of preventable and treatable conditions because of a lack of coverage from their insurers. This is inexcusable and will not be solved by a free-for-all system that is entirely capitalist and unmonitored and or unregulated by government. People like Mr. Killian can claim otherwise all they like, but they have no evidence to back it up, only blind assertion and the mantra that private companies can be trusted to do the right thing, which history has proven time and time again is not the case. The simple fact is, that businesses of all sizes are in it to make money no matter what they do or how big they are, even if their proprietors are also passionate about the nature of their business. Only not-for-profit concerns are an exception to this rule, and trusting your life in the hands of for-profit businesses that have no accountability to a government or an organisation powerful enough to force them to be accountable to their customers is insanity. Something does need to be done about the system in the USA, as needs to be done about the NHS. But the last thing any sane person would consider is giving everyone unfettered ability to set up a medical centre just because they claim they are a doctor, and that's what removing regulation will allow. Mr. Killian will no doubt come back to the subject with a bunch more massage statistics and figures he's managed to manipulate, but from someone who is a literalist to the point of absurdity it doesn't matter. This video serves as the last, for now, in a series that demonstrates this horrible little character for what he truly is. Irrational, egotistical, dogmatic and evangelistic, and willing to practice hypocrisy at every turn. For my part, nothing else needs to be said.